In its efforts to build stronger health system that will protect communities from diseases, the government of Central Equatoria State, in collaboration with health partners, is continuing to invest in preventing, saving lives and ending malaria through community health facilities which aim to bring healthcare servers closer to communities. One of these health facilities, built by the government of Central Equatoria State with funding from Society for Family Health Rwanda and South Sudan, is Gudele Community Health Facility, located in Gudele Block 4. The facility will provide services to the communities in Block 4, 5, 7, 9, and in parts of Munuki and High Referendum. Gudele Community Health Facility is a one-stop shop for all mini-medical services, including in-outpatients. The main focus of this center is fighting, preventing, and ending malaria in the country. Malaria burden is most entrenched among the poorest communities, who often lack adequate knowledge about the causes, consequences, and capacity to afford treatment and adapt preventing measures.
I'm a medical doctor by profession, but I'm the facility in charge for Gudele Health Facility, Block 4. I'm working for Society for Family Health in partnership with the Ministry of Health. In this facility, we have 5 departments: the outpatient department, inpatient department, maternity department, ophthalmology, and dental department. The lab tests that we have in this facility, we have the rapid diagnostic test for malaria, for typhoid, for syphilis, and we have a viral screening test, that is hepatitis B, hepatitis C, and HIV test. Maternity department, we have services that we deliver to our mothers at ANC. We do all ANC consultation follow-up, and then postnatal consultation follow-up. Our main objective for this facility is to prevent and treat malaria. The drugs that we are using for treating malaria is the first line guideline according to Ministry of Health, that is artesunate plus amlodipine. The second line is Lumaten tabs. The third line is quinine. We are using artesunate injection. Per day, I used to receive 11 to 15 cases per day. That is the average number per day. Per week, it's 40 to 55. From the beginning, when we started, the number of malaria cases has reduced. Unfortunately, just this month, the number raised again because of the rainy season, but we are still working hard to educate our community to early identify the disease and treat.
SFH is a non-governmental organization. It is a Society for Family Health. It started in Rwanda. There is 10 years ago, and now SFH South Sudan has been born from SFH Rwanda, and we launched our programs of coalition on 9th August 2021.
Rapid test and malaria microscopic, malaria rapid test and hepatitis C, B rapid test. We have viral syphilis test. Also we have H. pylori test and ASR test and urine and stool test.
He got his treatment, he was having malaria, and he testified the place here was beautiful, clean, and the services are well. So he got well. Today we have the title,
There is compelling evidence regarding the fact that children and women are more vulnerable to malaria-related morbidity and mortality, with pregnant women about twice more likely to be at risk of transmission. Besides the direct consequences, malaria during pregnancy also contributes to maternal anemia, which is associated with higher risk of pregnancy complications and adverse birth outcomes.
We started with a malaria program where we have the treatment and the prevention. Our focus is on malaria control and prevention, health system strengthening, capacity building of healthcare workers, and social behavior change. Actually, in behavior change, we work with those community health workers who have trained them as the one who will be mobilizing our community for malaria prevention, just promoting sleeping under mosquito bed net, and use also other means, especially for those mosquito repellent. So we have two kind of mosquito repellent. We have those lotions. They are used, just they are applied on the body, and the mosquito cannot bite someone. We have also those coils. They are using just when you are sitting like in a room. You burn them so that the mosquito cannot enter in your rooms.
For prevention, we do it in two parts. One is educating our community regarding the effective use of mosquito net, and then we have mosquito repellents that consist of a mosquito repellent lotion and then mosquito coil.
For now, we are doing a social marketing. We distribute those products to the community through private sector with affordable price, and also here now, as we are promoting our community for healthier life, we are now distributing. We mix the approach, social marketing and free distribution, where each and every patient coming here get at least one box of coil.
Come on, the one who register and send consultation to the doctor. And here before me, I'm having the mosquito repellent. This is the lotion where we apply. It prevents people from malaria. And this is the oil. We also give for patients. Whenever we find a patient having malaria, we give. To prevent or to help him or her from getting malaria. This is the repellents where we give to help community to prevent themselves from getting malaria.
The drugs for the malaria, they're highly being used. And then we have for other infections like typhoid, UTI, we have those of cefixime tabs. We have for IB safe 1 gram injection. Then we have Pilo kit. This is for ulcers. We have omeprazole. This is for ulcers. We have super appetite, Toractin, and many others. We also have mosquito repellent.
Gudele Community Health Facility also uses community health mobilizers approaches to promote the use and uptake of malaria prevention and treatment within the community, especially among pregnant women and children, as well as vulnerable people.
We have like between 10 to 15 per day cases of malaria. And that's why you can see that the program of malaria control is highly needed. See, for example, we know that the case is there, the problem is there, and the means of fighting, the intervention is also needed because the cases, the program is there, the threat is there, so the solution also is needed, is very important.
Progress in fighting malaria, saving lives and preventing new infection cases in South Sudan can be achieved mainly through widespread access to preventive tools such as insecticide-treated mosquito nets and indoor residual sprays, with an increase in rapid diagnostic testing, access to artemisinin-based treatment.
Have those community health workers, they do both product distribution and mobilization. So we get the report and the feedback from them that people are really using those products, and we hope It is still earlier, but we hope that the means and the strategy will help to reduce malaria cases.
We are offering the mosquito repellent and the mosquito coil for free for each and every patient.
We are partnering with the government through Ministry of Health. Recently we get the letter to reach Tarkeka state, so we are still working on it, and we are trying to expand the project to the whole country.
This mosquito repellent is provided now for free. It's a joint work of the Ministry of Health and then the Society for Family Health.